Nowadays, many people are experiencing pain and discomfort all throughout the spine. And the thing is, this isn't limited to one type of person or occupation. Office workers, drivers, soldiers, sport athletes, and everyone in between is being confronted with pain in the lower back, stiffness in the mid-back, and an overall lack of mobility up here in the neck. So why is this, and what can we do about it? The first step to remedying some of our most common spine issues is to have a good basic grasp of the anatomy and function of the spine. Now we'll expand more on these concepts related to the entire body in another video, but for now we want to understand the following. First, the lower back or the lumbar spine here is comprised of the lower 5 vertebrae of the back. The main need of this section of the spine is to provide a stable, strong center of the body. This is why the Guardian Strong training method places such a large emphasis on stabilization exercises such as loaded carries and plank variations, and stays away from twisting and flexion-based ones like sit-ups and Russian twists. Secondly, the mid to upper back or the thoracic spine here is comprised of 12 vertebrae, including all of those which attach to ribs. The main need of the T-spine, as we call it, is to provide a mobile base off of which the entire upper body can move and rotate. And then third, the neck or the cervical spine is comprised of 7 vertebrae. These, however, are split in their roles, with the lower C-spine being a stable set of vertebrae and the upper C-spine a mobile set so that we can rotate our head around like so. This is what can go wrong with these sets of joints. First, with the lower back. The area of the lumbar spine can try to do 2 jobs that it's just not made to do. The first of these is that the muscles down here on either side of the spine will try to act as hip extensors to be able to extend the hip backward like so, as if when you're walking or running. This is due to low activation and or weakness in the glutes. It also puts a lot of undue strain on these muscles in the back. The second is that this area of the body, especially the spine, the vertebrae themselves, they try to act as a mobile set of joints due to a lack of mobility down here in the hips. See a pattern here? Since the lumbar vertebrae aren't meant to rotate this much, this is also very problematic for the lower back. With the mid-back, or the thoracic spine, due to common postures nowadays, such as this, or sitting and typing, sitting on my phone, or just standing like this, we end up losing a lot of mobility and can end up with a lot of tightness here in this area. For tactical operators, for example, body armor packs and oxygen tanks can contribute to this as well if we don't remedy it. These postural problems end up having some negative effects such as pain and a lack of overall upper body movement capabilities. For the neck, similar problems can occur with the neck as do in the thoracic spine, as many people spend a lot of time down like this on their phones or their computers. These types of postures tend to immobilize the vertebrae, causing pain and a loss of movement. Now that we have a good basic understanding of the anatomy and function of the spine, we're going to talk about a few exercises that are key to keeping that spine healthy. First thing we're going to do for the cervical spine, we're just going to sit down in any normal chair, and we're going to take our chin, push it back, kind of make yourself a double chin, and extend the neck back. All right, so obviously I'm looking over to the side here, but we're going to want to stay pointed straight forward here. So what this is going to do is really going to allow me to target those upper cervical vertebrae, the ones that really need that mobility. The next thing we can do is for the cervical spine, but we're starting to get a little bit into the T-spine as well. We're going to be sitting down also. Now this one, depending on the type of chair you have and the height of the chair and your body structure, you may need to maybe put a thick book down here and or a towel over the back of the chair here, just so it's not kind of cutting into your back there. So what we're going to do, we're going to have our hands pretty much on our hips here. We're going to double chin again. and go all the way back. So again, now what I like to do is try to find a point when I look back that I can challenge myself to get to that point in terms of my mobility. So if you're able to sit in the same spot every day when you do these, you can have some kind of depth gauges behind you to see how far back you're going. That can be very helpful. Now the next one we're going to do, kind of working our way back down the spine, is going to be specifically for the thoracic spine itself. This is one of the most important exercises we can do, again, because we tend to have that hunch forward posture so much in a lot that we do nowadays. So what we want is a surface that's about, I like to suggest about mid-thigh height for you. Now we're going to use a physical therapy table here. You can use a bed, you can use the side of a couch, side of a recliner chair, anything like that. But just try to find something that's about in that range for your height, all right? So what we're going to do, we're going to kneel down. Going to put our elbows up here on the surface. I've got my hands kind of back here when I'm starting. I'm going to start in this position right here. Now, what I want to do is stick my hips back and extend my T-spine down. Now, you may have to play around with the exact position of your knees just so you can get a good angle. So essentially what we're going to do, again, hands are starting up here. I'm down, getting that extension in from my upper back, and I'm back up. Extension, and back up. Extension, and back up. Something I want to be careful of on this is not curling my head down like that. That's just going to reinforce that flexed forward posture that we're actually trying to avoid in this. Another exercise that I can do for my T-spine is sitting. I'm going to sit at the edge of a chair. I'm going to sort of interlock my fingers back here behind my neck and stick my elbows together like so. Now I want to make sure that my elbows are stuck together this whole time. What I'm going to do now is hinge forward a little bit, and you'll want to keep that back straight but at an angle. Want to make sure that we're not just rounding it. We're here, and what we're going to do while maintaining that hinge forward angle of my back, I'm going to drive my elbows up right into the sky. Drive them up, and we're down. Drive them up, and we're down. Drive them up, and we're down. Now again, I want to make sure that I'm not coming back up to here in between each repetition. I want to try to maintain that forward posture. Now this next exercise is going to be great for stabilizing that lumbar spine area and also helping to activate the glutes a little bit, because as we mentioned, low activation of the glutes is a main contributing factor to the lower back trying to do something it's not really made to do and then getting a lot of strain on it. So when I first came across these exercises, I'm pretty sure I heard them referred to as collaterals, so that's what I tend to call them. Many people refer to them as bird dogs, so you may have heard of that exercise before. A couple keys for this exercise is we're going to start out in a quadruped position, so 4 points, knees, knees, hands, hands. And what I'm going to do is extend opposite arm and opposite leg at the same time. Now a couple keys here. I want to make sure that I'm looking straight down at the ground. I want to make sure that I'm not curling my neck in like this, but I'm also not arching it up like that. So what I want to do first, so I'm extending opposite, opposite, and you'll notice the angle of my ankle that is up is at about 90 degrees here. I want to make sure that I'm doing that to reinforce that dorsiflexion, which is very important for overall movement abilities, especially athletic type movements, rather than having my toe pointed out like so. So I want to try to keep that 90-degree angle. As I'm up here, I want to make sure that I'm bracing my abdominals, reinforcing that lumbar area, but I'm also activating my glutes here. So I'll go up, up, And you can either go all through with one side and then switch, or you can alternate each repetition. Another key in this exercise, I want to make sure that I'm not arching up like so. I want to keep a good straight line as much as possible throughout my body. So activate those glutes, activate the abdominals. So you should be able to feel that glute firing back there as you have your leg up. And again, that ankle angle, very important. So there we have it, 5 great exercises that you can perform throughout the day to help improve the health of your back and spine. What I suggest is splitting those up, such as performing a couple sets in the morning, a couple maybe at lunchtime, and a couple in the evening. I suggest starting with repetitions in about the 8 to 10 range for each of these drills, and performing them at least 2 or 3 times a day to really help reinforce that good mobility, that good stability, and that good posture overall. Till next time, keep climbing your mountain. Stay awesome.